I call the honourable member for Denison.
Madam Speaker, my question is to the Prime Minister. Prime Minister, the government claims the GP co-payment is necessary to rein in Medicare. However, GP services are a small fraction of Medicare costs and just 1/5 the size of the total hospital bill. The reality is that GPs keep down the cost of other health care, especially ER departments. Prime Minister, why then would you target GPs when they are in fact saving money for taxpayers and when the Medicare blowout lies elsewhere?
I call the honourable the Prime Minister.
Well, Madam Speaker, I'm happy to take the question from the member for Denison. Very happy to take the question from the member for Denison and to agree with him that, in fact, good general practice is an absolutely vital part of our healthcare system. Madam Speaker, I was the Health Minister for 4 years, as I'm sure you would remember, and I did everything I could to improve our health system, including the operation of general practice. There were bulk billing incentive payments put in. There were GP care plans established and expanded under my stewardship of that portfolio, because, Madam Speaker, I appreciate, in a way that I suspect not all health ministers have, that GPs are not the gatekeepers to the system. They're certainly not just gatekeepers to the health system. They are at the heart of holistic patient care. Good general practice is at the absolute heart of holistic patient care. I absolutely take the point that the member for Denison makes, that general practice is but a part of our Medicare system. I might also make the point that the PBS is perhaps 1/5 of our healthcare spend, and there are co-payments in the PBS. There always have been, and those co-payments are supported by all sides of this House, I presume. But, Madam Speaker, I want to conclude the answer by reminding the member for Denison of the fundamental principles that this government is pursuing.
The Prime Minister resume his seat. The member for Denison on a point of order.
On relevance, please, Madam Speaker, the question is why are we then
the member will
targeting
resume
GPs?
his seat. There's no point of order. The Prime Minister has the call.
Madam Speaker, just as I was the best friend of Medicare as Health Minister, I am determined to be the best friend of Medicare as Prime Minister. All of our changes in health are designed A, to protect the vulnerable, B, to ensure that our health system is strengthened for the long term, and C, to guarantee that our health services get better and better over time. And, Madam Speaker, that is why the Health Minister is now engaged in very extensive consultations and dialogue with a whole range of the medical profession, and I can assure the member and indeed the House that the government will not be bringing further proposals forward in this area without the backing of the medical profession.